Thank you very much for providing us an opportunity to present a project which is close to our hearts, implementation of an allogenic serum eye drop service. So who are we? NHS Blood Transplant, or Department of Health Special Health Authority, responsible for collecting, processing and supplying blood components to hospitals in England, facilitating, promoting and coordinating organ donation and transplantation in the UK. And we also have diagnostic services to support transfusion and transplantation activity. And we also have specialist therapeutic services in terms of therapeutic apheresis services and specialist therapeutic products in terms of cord blood, stem cells and tissue allografts such as corneas, heart valve, skin and tendons for transplantation. So serum eye drops are blood collected into a dry pack without any anticoagulants, allowed to clot, and the serum is separated by centrifugation and diluted and dispensed in clean rooms without any preservative as serum eye drops and issued to the patients. Historically, the serum eye drops were prepared by blood donated by the patients themselves for their own use, known as autologous serum eye drops. Allogenic serum eye drops is what this project is about. It is prepared from blood donated from unrelated voluntary blood donors, which is a relatively new concept. At this point, I have to mention in the UK, serum eye drops are classed as an unlicensed or specialist medicine, and we have a manufacturing license to prepare the product. So this presentation, I will not make any claims about the therapeutic benefits of the product, but focus only on how NHSBT provides the service. So severe dry eye disease, it can be caused by immune or non-immune causes listed there, and it can have a devastating impact on the patient's quality of life with extreme pain, loss of visual sensitive acute visual vision, and also complications related to the disease due to eye infections or perforations. In severe cases, the ophthalmologist may consider prescribing serum eye drops if none of the conventional treatment work. So NHSBT started providing serum eye drops, autologous serum eye drop service in 2003 following a study performed in Leeds in 2002. Basically, the service established itself by continued provision of autologous serum eye drops to the patients, and then with the word of mouth it spread to the other centers. Over the next 3 years. The donations were collected either in the therapeutic apheresis units or the blood donation centers. Processing was done at the local blood centers, but dispensing was always done locally depending on wherever the clean rooms were available. And it moved to Liverpool in 2006 because we had the state-of-the-art building with several clean rooms. In 2003, because it's a small volume service, to give expertise and to maintain the expertise, it was centralized in Liverpool with the processing and dispensing, everything was done in Liverpool. And more importantly, a central administration hub was established, and tissue and eye services took overall responsibility for the service. So why do we need allogenic serum eye drops? 50% of the patients who are referred to the service are not healthy enough to donate blood. When we turned down the request for, the clinicians started appealing against our decisions. So we were looking at the risks of donations and they were looking at the benefits of the treatment, and children cannot donate blood. And people who are already entered the program, they have to be deferred sometimes because they have poor veins or they become anemic or they experience adverse events of the blood donation, and they become upset and they become devastated. And also there is a group of patients who need urgent treatment who are inpatients in the hospital. So it becomes obvious that there was an unmet clinical need out there, and more importantly, NHSBT can do something about it to address the need. So we started planning this in 2012, did a literature review. There are little evidence in the literature to support this because there are some publications from Asia where relatives or friends have been donating blood for their relatives. And then we established the clinical advisory group with the ophthalmologist to advise us on that and work with us, develop the business case. And then implementation process was about 18 months. We got NHSBT senior management backing and clinical governance approval, set up a project board and set up a cross-functional project team, and more importantly consulted with the regulatory authority and basically implemented it through a change control process through our quality management system. Throughout this implementation phase, we kept a communication both internal and external, and it involved the blood donors in terms of leaflets and advertised in the internal newsletters, and so we kept them all informed all the time. The service went live on 30th of June 2014, which is a Monday. And since then, we've been monitoring the activity regularly and did a couple of satisfaction survey. We also collect patient-reported outcomes and clinical outcome to support the Royal College of Ophthalmologists. So this slide tells the story of that service. In 2008-9, we were doing about 200-250 batches per year. 2013, before we introduced allogenic serum eye drops, we were doing about 450 batches a year. At the end of last year, we had done 1,500 batches a year. In the number of patients, if you look at it, in 2013, before we introduced the service, there were 230 patients receiving autologous serum eye drops service and no patients in allogenic serum eye drops. By the end of January this year, there are 340 patients on autologous serum eye drop service and 390 patients receiving allogenic serum eye drops. When I say there are patients, active patients, these are all the patients who have received at least one batch in the last 12 months. So allogenic has already overtaken autologous serum eye drop service. So each triangle is the address of the patients to whom we deliver serum eye drops to. Basically, the patients go to the clinic and the consultant either emails or fax the clinical request form, and we contact the patients to arrange for delivery. So we cover from Lansing to John O'Groats. Even we have a patient in Scottish Islands. So the patient age group from its 1 year to 92 years is the oldest. So these patients, they just receive the service sitting of the comfort of the home. They don't have to travel to a blood center to donate blood. The first one on the consultant feedback is the first ever patient who received the first batch before we introduced the service early 2014, because this is the 82-year-old frail patient, and the patient wanted to put her in an ambulance with the clinical team and send it to us to donate autologous serum eye drops, and she was no way going to be fit to do that. And so as a compassionate groan, we said we'll do one off, and that was the feedback, and we were able to help that patient. And the next one is a patient feedback as an example. This is just about the service, and she feels that this spectacular service is not, I hope it's not withdrawn by the NHS, and congratulating our team for the way they treat it in an efficient way. So for me, what are the key learning point of this is that two things. There is accurate projections. What we thought we are going to achieve in 3 years, we achieved in first year, and the service is continuing to go when we are getting constant stream of requests. And then we have to put the patients and clinicians at the center of the service. If there is a service they want, and if you work with them, and if you work with them collaboratively with all your teams and with your clinical team, definitely there is a need for the service. What are the strengths and weaknesses of the service? We are a blood service, so we have established quality management system for blood collection processing. And even though 1,500 is a big number, when you consider we do 1.5 million donations a year, it's a fraction of the thing, so we have access to the donor. But the limiting factor is not that. It is the limiting factor is the clean rooms, availability of the clean room, and there is a competing interest because we need the clean rooms to process stem cells, heart valves, and whatnot. So we are moving, we are currently looking at going into closed system, the picture shown there, and which is undergoing trial this week. Hopefully that would help us to expand the service more. So we are the first service in the world to systematically introduce this service. So we are international pioneers in that. So other blood services are contacting us for advice and guidance. So there is opportunity through Alliance of Blood Operators and International Society for Blood Transfusion to set up international service. Currently the standards were developed by ourselves, so we need to agree on international standards and protocol to make it as a uniform practice. One of the things is it's being managed by different regulatory rules applied in different countries, and that is seen as both a benefit and threat. We need to harmonize that as well. So I want to, my last slide, acknowledge the clinical advisory group. These are all the ophthalmologists, Prof. Figueredo, Prof. K and Ms. Ross, who were in my clinical advisory group. And Royal College of Ophthalmologists have recently published a guidelines for serum eye drops for the treatment of severe ocular surface disease to advise clinicians as when to refer patients and when to stop the treatment. And also for the NHSBT staff from the blood donation and processing and everybody involved in the service. My team are up there and they are very proud of this service, and to the patients and donors and without whom we can't provide the service. And this is one service that truly brings tears to their eyes. Thank you very much.
Thank you. Wow.